All right. Good morning, Southcoast. This is Mike Sylvia with Fall Reporter and New Bedford Guide. We are here to talk to another Southcoast doctor. We're here with Dr. Peter Cohn from Southcoast Health. We do a weekly interview. It's your chance to actually ask some questions of a doctor. We get about 10 minutes, 15 minutes to talk to Dr. Cohn. So, Dr. Cohn, if you could just tell us a little bit about your background and where you work in Southcoast Health right now.
Sure. So I've been in clinical practice in Fall River for 27 years, since 1993 when I came out of my cardiology fellowship, which was at UMass in Worcester. And I joined what was then Truesdale Cardiology, private practice with two other docs. And from there, we've initially grew to a practice of 8 providers, 6 physicians, 2 nurse practitioners. And then in 2011, we joined Southcoast. We were actually the first cardiology practice to become part of Southcoast. But for the many years before that, our practice, private practice, was closely aligned with initially Charlton and then what became Southcoast 25 years ago. And we were all integral in helping to build the current cardiovascular program. My current role is I'm the physician chief of the Cardiovascular Care Center, which consists of cardiology, cardiac surgery, and vascular surgery. In addition, being the physician in chief in my administrative role, I still practice general cardiology, invasive cardiology, which includes cath and devices, pacers and ICDs, as well as non-invasive cardiology. So I wear a lot of hats.
Yeah, so Charlton Memorial, it's kind of the hub of cardiovascular care. If you can just kind of talk to people, was that always like that? Has it kind of evolved to that?
It's absolutely evolved. When I came here in 1993, Charlton had just opened up a very small shared diagnostic cardiac cath lab. When I say diagnostic, there was no cardiac intervention, stents. We basically took pictures, and then anybody that needed advanced procedures such as surgery or stents weren't even invented then. They came around a year later, but they needed an angioplasty, we would have to send them elsewhere. But it was a start, and actually in 93, for just a community hospital to get a diagnostic cath lab was actually a big deal. Before that, cardiac cath was only done at tertiary hospitals, and we were one of the first in the region to get a diagnostic cath lab. But it was really in its infancy. Majority of patients went to Boston or Providence. And so it was a very different place, although very busy, always busy from a cardiovascular standpoint. And the practice had a large amount of patients at the time. It's just that the care could not be centered strictly in Fall River. We had to utilize, as I said, Providence and Boston. And that clearly has changed over the years and evolved.
Yeah, so when you talk cardiovascular, you talk heart health. What is some general advice? When I grew up in the 80s, it was a food pyramid for us and that kind of stuff. Is that still kind of relevant, or is there some kind of better way to kind of eat healthy for heart health?
No, I think basic eating. I mean, there's been lots of different recommended diets, the AHA, the hypertensive diet, low fat, low cholesterol. But I think the basic tenet has really not changed in terms of fats, cholesterol, low fat, low cholesterol, lean meats, chicken, fish, vegetables. I mean, that is, whether you call it the Mediterranean diet or the heart health diet, the diabetic, the basic tenets are all pretty much the same.
Yeah, I read it. I'm someone that tries to eat healthy. My wife's a vegan. I try to eat as much vegetables as possible. But one thing I've read, and obviously I'd like to get your opinion on it, is they're talking more and more how bad sugar is for your cardiovascular health. Is that something that you agree with, or?
I mean, like anything else, we all need carbohydrates. We all need sugar. But I think an excessive amount, especially processed and a lot of processed foods, I think really what's really been a negative for the American diet has been over the last 40, 50 years, probably 50, 60 years, we've lived in a world of processed foods, fast food. And I think And with that, those type of foods are high in sodium, which for hypertension is really bad. And corn syrup, fructose, all the things all the foods that all the treats that we like to enjoy. I think those are really negative. Not to say that you can't eat some of that, but I think we in the U.S. eat an excessive amount, and which is why obesity is such a problem here. And I think that really stems from, the fast food market. It stems from convenience foods. We clearly have seen it a lot during the last year during the pandemic when, yes, people have not been going out to eat, but they've been doing a lot of takeout, and with between the takeout and less exercise, especially in our older population, we're seeing people gaining, my patients will come back, and hopefully nobody gets insulted who's watching this, but, they'll typically admit it, 5 to 10 pounds in the last year because of changes in diet, more takeout, more convenience foods, and less exercise. So it's almost like a little microcosm, an experiment, really, and you can see it.
Yeah, I'm going to take one question here. Bernice says, Dr. Cohn, I have a Afib, and I'm on blood thinner twice a day, 150 milligrams twice a day, and 120 twice a day of sotalol. Yeah, I'm going to pull this up so you can kind of see it.
Yeah.
So the question is, why is it that I'm taking these medications? I'm still getting a fast heartbeat every once in a while. Why is it that I'm taking these medications?
Well, and it looks like also Bernice has had an ablation in 2018. So ablation, although it's a great tool to stop AFib, there is a percentage of recurrence of atrial fibrillation. So I suspect that if Bernice is still having episodes of AFib, she's having recurrence, which is why she's still on the sotalol. The Pradaxa is a blood thinner to prevent stroke, because one of the major risks of having AFib is stroke, and that protects against stroke. Sotalol is hopefully keeping her out of AFib more than she's in AFib. If she's continuing with AFib despite 120 sotalol, I presume that she sees a cardiologist and an electrophysiologist, and maybe it might be time for a redo ablation, which we do quite frequently, because the areas that get ablated sometimes grow back, and a touch-up ablation a few years after is not uncommon.
And we get this question with every doctor I bring on. Are you accepting new patients? So she's 47, heart fluttering, never had heart tested, but have heart conditions and diabetes run in the family. I'm in need of getting taken care of.
So yes, Tammy, I personally am taking new patients, although my new patient availability is a little less than my colleagues, just because of my administrative position as well. But either myself or my colleagues, either at my Fall River office or at Southcoast, we have offices, cardiology offices. There's 2 here in Fall River. There's a cardiology office in Middletown, if that's closer, Providence, if that's closer, New Bedford, Fairhaven, and Wareham. And all of us are taking new patients.
Yeah, if you got a question for the doc,
we love new patients. We love to see people, and it's really what we enjoy. So absolutely.
Yeah, if you got a question, just throw it out there. Yeah, so Tammy respond. Fall River is perfect. So yeah, so give Southcoast Health a call. Ask for Dr. Cohn. See if you can get it in his schedule.
Yeah, or again, one of my colleagues, if they can get into it. We're all good. We're all good.
Yeah. Bernice says the same thing. Thank you. I'll make an appointment with my cardiologist. So Southcoast in 25 years. Can you tell us what it's like firsthand to see it grow and evolve? And I'm sure I think it was Newsweek came out and had Southcoast as one of the top hospitals in the nation as well. So what is it like working for Southcoast Health?
I think working for South. So there's 2 questions. One, what has it been like to see it grow? And I'll take that one first. It's been really fantastic for me to watch the evolution of cardiovascular care at Southcoast. And really, this is where I've spent my entire career. I mean, this is the only job that I've ever had. And I mean, I always say I've had 2 employers. One was Truesdale Cardiology, which I was a partner in, so I was employed by my own practice, and then Southcoast. But essentially, I've worked in the same practice for all my career, just in with different affiliation. And I watched this place grow from, as I said earlier, a small diagnostic lab, which we shared with radiology, to a point where soon after the merger, we were very fortunate to be able to get involved in a clinical trial. We hadn't started cardiac surgery here yet, but we were able to get into a clinical trial treating acute heart attacks with stents. And what allowed us to do this was a trial sponsored by Johns Hopkins called Seaport. And it looked at community hospitals such as ours without cardiac surgery and whether it was safe to do stents in the setting of acute heart attack. And we compared patients who were able to get stents versus those who got what was then the norm for heart attack treatment, which was a clot buster. And this being involved in this clinical trial and proving that stents, even in a hospital without cardiac surgery, were superior, allowed us to then put it in an application when the state allowed 3 new cardiac surgery programs. We put an application in, and it made us the leader. And we were granted a license to do cardiac surgery in 2002. We were one of 3 hospitals that got that, got awarded a program. And we were the first in 20 years in the state of Massachusetts to be awarded a new program. Prior to that, all cardiac surgery was done pretty much at what we call teaching hospitals. And we were the first. And since then, we've been the most successful. And of the 3, one program, North Shore has since closed. Cape Cod is doing very well, but our cardiac surgery volume exceeds them. And we actually exceed volume in some of the smaller programs in Boston. Along with that, we were able to grow our cardiac interventional program. So we're now one of the leaders in treatment for acute heart attacks. We're a destination center for heart attack care, bypassing hospitals that don't have cath lab. We have early activation from in the field through EMS to alert our heart care team. So all of this has grown in the last 25 years. And clearly it's a function of that. We wouldn't have been able to do this if not for the merger and the formation of Southcoast.
Yeah, I think
go ahead.
No, I was going to say for me, the biggest growth I've seen is those urgent cares kind of popping up everywhere for Southcoast Health. Because I know many years ago, the biggest complaint was the emergency room filling up, but it was because it was a non-emergency, but they were urgent, right? So I saw all these kind of urgent facilities, and I know I've used them. Everyone that works for me used them. My wife's used them, and they've been great because they see more availability, and it relieves that stress off the emergency room, I think.
Right, but I think urgent care is great, but if you're having, I'm telling this to the public, if you're having active chest pain, please don't go to the urgent care. We have, every couple of weeks we get somebody goes to the urgent care with chest pain, has an EKG, and then they're calling the ambulance to ship them here. So if you're having chest pain, that's something that you need to go to one of the ERs. Primarily, I would encourage Charlton if possible, just because this is where our cardiology facilities are. But even if you go to one of the other hospitals, we can transport you here. But yes, I agree with you. The urgent care certainly has helped to decompress the ER so they can take care of the sick patients.
Yeah, if you have anything that's emergency, 911 or right to the emergency room. But
right, exactly.
Generally the urgent cares have been great, I think.
So
I'll do a final comment from another viewer. So Tammy asks again, and this is a common question people have: are the FitBits and the iPhone, the iWatches, that stuff, are they accurate in your opinion for blood pressure and other kind of health things?
Yeah, I mean, I would say maybe not for blood pressure. They may be accurate. You have to compare. But where I see the future in some of the watches, in particular, like the Apple Watch, I think that wearable technology is the future. I've seen some examples of patients who have shown me rhythm strips that they've gotten from. Now you have to be careful because certain levels of say Apple Watches, like some just do basic heart rate monitoring, but not in a true rhythm strip, EKG. But there are some now that can actually store an EKG, send it to your phone, and then bring it in and you can actually show your cardiologist. I don't want to be in the product promoting business, but there is another device. I believe it's called Cardia, which is absolutely amazing. And please, I am not promoting a product. There's others like this. This one comes to mind, where somebody could just put their 2 fingers on this little device, send it to their phone, and it gives it what we call a 12-lead EKG. And I've actually have patients show that to me, and I compare it to the 12-lead that I do in my office, and it's equivalent. So I think wearable technology, it's still in evolution, but I absolutely think it will be the future. And once we allow it to then interact with our Epic system and allow access for those rhythms and monitor strips to come in, I think it's going to be a game changer. I mean, right now we do implantable monitors now that people can wear. They're put in under the skin for like 3 years, and it's great data. And I'm not discouraging people from doing it, but I think I'm just going to throw out 5 years from now, I think those will be obsolete, and we'll be all, giving people Apple Watch. And I bet you, and I suspect, I don't want to speak for the payers because you never know, but I suspect that the payers will be, probably reimbursing for this stuff.
Yeah. So the best advice probably, and you can confirm maybe, is use it recreationally now, but don't use it for medical,
No, but some of the ones that are good, I don't say do it solely. But I do tell patients, if you're having palpitations and whatnot, it's not 100%, but it's certainly worthwhile. I mean, you're paying for it out of your pocket, but I think it does give you some good data, and I don't discourage people from doing it at all.
Yeah, it might alert you to some problems that you have.
Absolutely. I've seen a couple instances where it has. So,
yeah.
Yeah.
Okay. All right. So this was Dr. Peter Cohn. If you want to check out his bio, you can go to Southcoast Health's website. He's at Charlton Memorial. Actually, I'm going to end with one question.
Yes.
And have you been to the Sweet Rose Cafe across the street?
Oh, the vegan cafe. No, I have not, but a lot of my colleagues have, and I've been meaning to get over there. It's hard for me to leave the hospital.
Yeah. So this is not a paid promotion. It's a free. I go there probably once a week. It's a great place. And I tell people, if you can get off that meat diet, the overly processed food, it's a great little cafe. It's right there right across the street from Charlton Memorial. So people should check it out. And if you're looking for like a alternative place, I just like to give a shout out to small businesses. The restaurant's been crushed during COVID, so it's a great little place. But you got to get over there as a heart doctor. So
yeah, so I've heard, but then and a lot of staff is doing takeout from there now, which is great. Compared to say, I won't do any negative about other businesses, but they're going to places like this for healthier options rather than some of the, let's just say, traditional places where they do takeout from. So that's
my recommendation is a portobello mushroom. They put a nice caramelized onion on the top. It's really, really good. Yeah. Tastes just like a steak sandwich, kind of. It gives that feel of it. But all right, I just figured I'd give a shout out to a local Fall River business.
Right. So I would be remiss to say, because I never did answer the question about working for Southcoast, and I certainly don't want our administration, who's been kind enough to get me to think that I was ignoring it. But actually, Southcoast is a great place to work. Southcoast Health. We as physicians and our APPs and our nurses are happy to work for Southcoast. It's a very supportive environment and really very focused on patient care as the number one priority. And so I think, the community can be really proud that Southcoast has remained an independent hospital. We're our own system. We're not part of some larger healthcare system. And I think that's great, with a very supportive board of trustees that really is embedded in this community and wants this place to thrive. And I think I would be very not happy working for some large conglomerate. I think this is really a great place to work, and I think the community should be very proud that we have Southcoast here.
All right. So thanks for your time, Doctor, and hopefully we'll see you again in the future, and have a good day.
Well, I appreciate it. Thank you. Okay.
All right. Take care.
Okay.